happy to introduce my colleague and coworker, Barb, who will be presenting today on building relationships and engaging networks. So Barb is from Superior Health Quality Alliance, and she's based in Michigan. If you have any questions during the time, just feel free to put your questions in chat, and then we can address them at the end. Thanks so much, Barb.
Okay, so let's see. That. All right. Are you seeing my PowerPoint presentation? Okay. And let's see. Wait, I'm gonna try, hold on a second. I practiced this beforehand, and for some reason, I always have such a hard time with this. Sorry, everybody. Let me see if I can get this. Let's see. So are you seeing the large, just general presentation? Okay, sorry about that. Thanks. And are you seeing my very first slide, or are you seeing the session didactic topics? That one?
Yep,
okay.
The session didactic.
Okay, sorry about that. So today, yes, we're at session 4, and we're going to be talking about building relationships and engaging networks. All right. So today's session is specifically about our one-on-one meetings to invite people to attend your community coalition or meeting or project that you would like to develop. And so this is a very intentional meeting that you're going to have. There's specific steps to this meeting. And so most people, even once a day, maybe once a week, you're inviting somebody to come to a meeting, inviting to have a phone follow-up call, whatever it may be. And you're not really thinking about the content of that meeting or how you want to frame it. But through this, when we're wanting to invite someone to our community coalition, it's a very intentional meeting that you want to have with a very select person. So there are specific steps. There are 5 steps to this meeting: the selection and attention or connection. Step 2 is purpose. 3 is exploration. 4 is exchange, and 5 is commitment. And so what I'll do today is go through the definition of each of those components of this meeting. It's a one-on-one meeting you're having with 5 specific steps. Then after that, I'm going to show a video of actual role play of showing what the 5 steps look like while one person is inviting another person to join their community coalition. And then after that, we're going to practice it. Everybody's going to be split off into pairs and do a role play of trying to put the 5 steps into action. Lovely. Now you're seeing purpose. Is that right? Did it move on? Great. So when you're thinking about this, so after step one is selection. So I'm going to put it in the framework of that home healthcare work group that I talked about when I talked about my story of self. So when I was thinking about my home healthcare work group, I had a lot of home care agencies involved in that, but I also wanted to extend it to hospital systems because I thought if we're going to try and figure out how to increase acceptance of home health after discharge, we need to have that component as well. So I am going to reach out to a director of hospital discharge planning or case coordination department. And I'm thinking very specifically of a person, her name's Jackie Smith. And actually Jessica, my coworker, knows Jackie very well because she worked on another initiative with her. So I'm going to ask Jessica, can I have Jackie's contact information? And can I use your name for sort of a warm handoff? Jessica says, oh, she's great, yes. So then when I'm reaching out to Jackie at this particular hospital system, I say, Jackie, I have heard that you have a wonderful intervention and you've really increased people accepting home care upon discharge from your hospital. So I would like to have you join my home healthcare work group, talk about your initiative. And Jessica Newsom from my organization says you're a great partner to work with. Would you be willing to meet with me to discuss this further? Jackie says, of course, Jessica's great. I loved working with her. Sure, I'll talk to you more about this wonderful intervention I developed. So then we move on to purpose. So now we're actually meeting together. Jackie and I have discussed a time in this COVID world, we're going to meet by phone. And I'm going to say, so Jackie, I'm Barb Link. I work with Superior Health Quality Alliance, and I'm developing a home healthcare work group collaborative. And I really would like you to join the collaborative because I've developed, since I've been working at Superior Health, I've noticed that home health care, once somebody accepts that upon discharge, we have much better results. They can stay in their home longer. They don't readmit as much. And so I really think that this would be a wonderful partnership if you would join my work group, and then you could discuss your innovative way that you've increased acceptance of home care upon discharge at the group and then exchange other ideas. So that's that, really discussing the purpose of why would I want them to join my meeting. You can do this for a multiple different types of people. You can do it for a new person. I'm just reaching out. I've never really talked to them before. You can use it for somebody who, you know, you really think that you've seen them in your work group or your coalition and they've really come a long way. And so you want to reach out to them and maybe expand their role. Or maybe somebody, they haven't come and you really think that they are a great partner, but you haven't seen them recently. You reach out to them again and try and reestablish a relationship. So there's many reasons why you'd be using this purpose component, but that's, for me, it's establishing a new relationship at this point. Exploration, step number 3, is almost the most important part. This is where you're getting their buy-in. You're finding out why they would be a great fit. When you're asking somebody for help, sometimes you don't always think of what they can do for you or what their area of expertise is. People love to talk about, for this example, this person developed this innovative way of connecting people to home care. She'd probably love to have, you know, somebody ask her about it, ask about the logistics. How did it get started? So this is where I'm asking why. Why did you do this in the first place? What made you passionate about it? What is sort of your vision for why you developed this specific intervention? So there's a lot of why questions in this particular part of the interview. And also it's more you're doing listening at this point. Before you're describing, setting the stage, now you're listening why they would be interested in joining your group. It's 80% you're listening, 20% you're sharing at this point. So if you're doing a lot of talking, you need to sort of step back and start asking more why questions and getting more of a sense of why they would be a good fit for your coalition. And this is all in one session. So it's a lot, but it's really drawing them out and being very intentional about inviting them to the work that you're doing. So moving on to stage 4, step 4 is an exchange. This is why would it be good for them to join your group and why would you want them to join your group? You're exchanging resources, information. So you find out they've got this intervention and you say, look, you're going to be exposed to a lot of home care agencies that are really kind of cutting edge in the area that you work in. You're going to be able to network. You're going to have access to information and toolkits. And lots of times when we're talking to people, we say, look, we have exposure to a lot of information that CMS is doing. What's coming up next? We're going to share that information with you. And you're going to be one of the people who know things before a lot of other people in the community because you joined our coalition. You joining our coalition is going to have, you're going to be able to spread your intervention. You're going to have access to a lot of people that you don't typically have access to. So it's an exchange here. Then you ask them, what other kind of resources do you have access to that you could provide to the work group as well? So again, it's building that we're sharing in this opportunity and exchanging. And then the last one, some people feel very awkward about this, but if you think about it, it makes perfect sense. Once you've gone through all the other 4 steps, then you're going to ask for a commitment. Now, as you've gone through this, maybe I find out that the director isn't really the person who developed the intervention. Actually, it was their intake worker at their discharge planning organization or unit. So she at this point says, you know what, really it was Sue, my discharge planner, who on a daily basis is discharged people from our hospital. She's really the one who developed this. You know what? I think you should have her on your committee, not me. I'm too high up. I'm too big picture. She's really nuts and bolts and she'd be better for your work group. And actually, as we're talking, I think I would be willing to let her take some time out of her day and attend your work group because it sounds like it'd be so important for our organization. So I'm going to put you in touch with Sue. This is where you're getting really specific. Thank you for telling me about Sue. Can you connect us by email? And by next Thursday, if I don't get that email from you, I'm going to reach out to you again and find out Sue's email address and how I can connect with her so she can come. Or if Jackie really was the right person, Jackie, I'm going to send you the invitation and I'm going to look for that acceptance that you're coming to our work group by next Thursday. If I don't hear from you from next Thursday that you've accepted the invite, I'm going to circle back and check in with you and make sure you're coming to the meeting. It's a real strong commitment. There's specific outcomes and actions from it. You know that once you leave that meeting, that they know what they're committed to, and you know what your next steps are if you don't hear from them. So it even after LOA training at our office here in Michigan, it became a joke around the office because even simple things in an email, I'd send people, okay, everybody, by close of business on Tuesday, I want your input on this document. And they're like, oh, Barb, you're LOAing it, aren't you? It's a very specific thing that you're doing and asking from people. And some people don't feel comfortable with that extra step of commitment, but it makes it very clear for both partners to know what are next steps and what is this person getting into. So those are the 5 steps of this particular interview. I keep saying interview, but it's a meeting because it's back and forth. It's not one way. It's a meeting with another person that you want to join your coalition. So in a broader sense, when you're inviting someone to join you, you want to use all 5 steps. Think of these 5 steps. Show passion for your work. When you're excited about something, it's like infectious. People really then want to join your work and you have a clear purpose. Ask them about what their vision would be for this particular topic. What do they see? You can get in, if you feel that they feel comfortable about hopes and dreams, great. But some people, it's more of a vision or a mission that they feel comfortable with those words when they're talking about work. How are you engaging together? Do they bring a slightly different perspective? You can play into that and say, oh my goodness, I never even thought of the problem that way. If you come to the work group, that's going to even make it better by having that particular insight into the work. And then making choices based on evidence through the one-on-one. So if they say, really Sue is the person for you, realize that, don't go on a hunch, ask more questions about Sue and get very specific about why she's a better person than Jackie was in this example. And don't worry, at the end for that commitment, feel good about making an ask. Feel good, because then that's showing them that they're important enough that you want to re-engage them. So don't be tentative about asking them for something. Okay. Now we are going to watch a video. It'll go through the 5 steps again, and then they're actually going to do a role play. So when you're looking at this role play, think a little bit about, is the person using the 5 steps? Was it effective? When the person that they're doing the ask of responded in a different way, how did the person kind of pivot and work with that? And then think about, would this be the way you do it? What went well? What you do differently? And then after that, we'll move into the role play and practice ourselves and try and use the 5 steps and see how that works for you when you're asking someone as well. Okay, here we go. Can you hear it?
If you look closely at any successful project or campaign throughout history, chances are they all include one key ingredient: strong asks. Strong asks are clear, powerful requests for help and support, including invitations for others to join you in the effort you're pursuing. They are essential to the success of a group in achieving a common goal. Whether it's a political campaign or a community coalition working to improve medication management, let's look at what a strong ask looks like in action. Meredith is a public health professional. She's spearheading a medication management coalition to decrease the number of adverse drug events in her community. Just like her, most others on her coalition are busy professionals. So how can she use community organizing tools to make strong asks to build her team? One of the most common, effective ways to do this is during a one-to-one meeting. The process of making a strong ask during a one-to-one meeting can be broken up into 5 different steps. Select and connect, share purpose, explore and discover, exchange ideas and resources, secure commitment. First, select and connect. Decide who you'd like to request support from by first looking at people with shared interests, who might also want to achieve your coalition's goals. Next, when you meet with the person, be very clear about your purpose or your reason for wanting to talk to them. Tell them why you thought of them for this request and what you want to explore.
Thank you for meeting with me today. So I recently set up a coalition. We're working to decrease adverse drug events. As you probably know, this is a critical national issue and we're seeing it in our community too. I felt I needed to do something, and with my healthcare background, I have so many resources to contribute. So I started talking to some colleagues, and we formed a coalition to come up with some solutions.
Thanks for reaching out, Meredith. I've seen the impact of this problem, and I agree it's urgent to do something about it.
Great. I know you probably have some ideas.
Absolutely. I have a lot of ideas to share. I think I can get my colleagues involved too.
Now, it's time for the important exploration and discovery phase. This is where you gauge their interest, capacity, and whether you think they would be a good fit for your group. Use questions that will lead you to identifying your shared values and resources. As you explore what you've been doing and where your interests lie, you'll discover how you can help each other, where you have resources you can share so both of you can benefit.
I thought of you for our leadership team because I saw your talk on medication management and safer medication use.
Oh yeah, it's really important to me. I've been doing research on medication management for a long time.
So I'm wondering if you'd be interested in joining our coalition's leadership team.
You know, I'm really interested, but I just started a new project. I might not have the time to join a leadership team.
I completely understand. But would you still be able to join the coalition?
Yes, definitely.
The next phase involves the exchange of ideas and resources. This is where you ensure the exchange is mutually beneficial. Identify skill sets and resources that will help achieve the common goal.
Can you think of anyone else that might be a good fit to join our leadership team?
Yes, actually. I was going to recommend my colleague Jim. He has 10 years expertise in medication management and medication safety issues.
Lastly, and most importantly, secure the commitment.
That's great. Can you put Jim and I in touch soon?
Sure, I'll introduce you by email sometime soon.
Wait. This may sound like a commitment, but there are no solid deadlines or guarantees. When you make the ask, be as specific as possible. This is the main difference between a weak ask and a strong ask. So let's try this again.
That's great. Could you connect us by Friday this week so I can invite him to our next coalition meeting on the 22nd?
Sure, I can do that.
Thanks so much. I'll send you a follow-up reminder on Thursday. And I'll send some information about joining the coalition.
Okay, sounds good. I can't wait.
Understanding how to make a strong ask is essential for any campaign or coalition. Remember to follow the 5 steps to ensure you get the support you need and reach your common goal.
Barb, can I ask you a question?
Sure.
So for some reason, I'm not sure why I'm not connecting the dot 100% on the exploration piece. So I'm just trying to think back to some of the groups I've tried to pull together over the years, and someone may have given me someone's name, but that's all I have. I might know that, I'm trying to think of an example. I might know they work for home health care, but I don't have anything really beyond that. So for the exploration phase, it seems like you need to know something about a project they've done or something to start that conversation for them to share more detail. Is that correct, or am I missing something? So if you don't really have a piece of something specific they've done, how do you do that exploration piece?
So yes, it certainly is helpful if you know specifically, like they've done an intervention that fits seamlessly, but lots of times you're right. That's not the case. You just know that somebody either suggested, or in the community that they are pretty active in the community for some reason. So I think that's some of you think of just like why questions, like, I've heard that you're very involved as a home care agency, and you seem to have a very good reputation in the community. When I give you this definition, what sounds interesting to you, or why would you even ask, why do you think you'd like to come to my meeting? And it's a little bit putting them on the spot, but it's interesting because, again, they might go, nobody's ever really asked me like that before. Actually, when I think of it, for example, the person I've done a lot of research in this area, and I have found that there's some best practices. And when we put them in place, we were able to find out correct phone numbers that we never could before. And and then they start talking. I hate to say, sometimes it just kind of goes from there. When you just plant a little bit of a seed, like, when I tell you about the definition of this, does anything sound interesting to you about why you might want to come to the meeting? Putting it back on them a little bit. And they're like, well, I don't have the time. But, when I think of your home care agency, I just think that it would be a great piece to come. Have you done anything in this area? Is there anything that you think that might be interesting to expand on? Just keep asking them questions and see where it goes. It's very interesting because people aren't usually asking people, why would you want to come to my meeting? And when you do that question, people are like, my goodness, I never really thought of it that way. I think maybe this, and this I could help you out with. So it's in a way empowering them and making them think a little bit about what is their skill set that could really help you out. It's very interesting how it kind of works. And I hate to, Janelle, I know you've said that you've done this before and it has kind of worked for you.
Yeah, and sometimes it's like you really don't know this person at all. So it's more like getting to know each other. Mm-hmm. And like, for example, I remember recruiting a big health system for an initiative. And first they knew what we were going in for, but then like, tell me what you're working on in your health system, what's important, and in my head all the time, I'm trying to think, okay, what would make them want to join me? And it ended up that we could offer some special training to their skilled nursing facility group. But I think what I really like about this, that it's a structured process and you end up with an ask. And it might just be an ask to meet again. It might not be for that big leadership commitment, but it might be an ask is really anything you want them to commit to for you. I don't know if that helps or not, but it's really it's fun to do. I've even just met up with people like, hey, let's have coffee and just talk about our mutual work and, see where we can work together.
Yeah, I would add to that, having gone through this training and practiced, it really is an opportunity to get to know each other. Even if you ended up not working together, you might in the future, or at least you know more about them. And so I think the example, the role play that we saw was a very shortened version, just to demonstrate the steps. But you would probably do it over coffee, or as Janelle said, or it would probably be a little bit longer given within the schedule that everybody had. But it really is a get to know you meeting. So if you think of about that way, it doesn't seem so constrained and forced. You're asking about them, and if you do know them, you're digging in a little bit deeper to maybe what motivates them and so on. So it's really a give and take, but you're following a kind of a process.
Thank you for those comments and some of those questions that you shared. I wrote down, so that'll be helpful. I think of all the asks I have done in the past, and I've never used any of this process. And so moving forward, it'll be very interesting to see the different response or the different maybe engagement when they first end up joining them, because we had this one-on-one versus just saying, yes, I'll join your committee and I just know this much about it. So thank you for answering those questions.
Yeah, and remember, you're not going to get it. You're not going to get everybody. You're when you have the meetings, you can't guarantee that they're going to join you, but that's okay. You're still getting to know each other, and they're getting to know you. And to some extent, it's a numbers game. And if you get a suggestion of somebody who else you can talk to, that might be even a more perfect person. So it's not just to suck them in, if you will. It's to get to know them and share resources and share about each other. And so you should walk away with a really good feeling.
Yeah. Is it all right if I just jump in real quick?
Yeah.
I'm Sarah, and I have an extensive sales background. And so a lot of what you're describing here is the process of sales. And that title kind of scares people a little bit, because when you think of sales, you think of rejection and a whole lot of things that go along with sales, which is why some people don't want to touch it with a 10-foot pole. But I am sort of a subject matter expert on this process, and it's very similar to other trainings that I've had. So, just to make it easy, and I think Nancy, you touched on it, Janelle, of course you did too, and Barb, so far this has been great, but this is really just a conversation. So if you tell yourself, hey, I'm going to give Nancy a call. Nancy, I don't know her too well, but I've been in some meetings with her. I've seen her around. I'm going to give her a call, and I might call Barb first and say, hey, can you tell me a little bit more about what Nancy does? And then because I need some help, you know, and then Barb might say, oh yeah, you should give Nancy a call. And then I call Nancy and I just say, hey, Nancy, I'm working on some things. I know we've been in some meetings together. Can you tell me a little bit more about what you're doing right now? Because I want to find out more about what you do, because I think we can really help each other. And then once people are disarmed and they don't think you're calling with an agenda, so to speak, they love to talk about themselves and share some of the great things that we're doing. And we're all in the same industry. So, you know, certainly this is really just an exercise in networking. And Nancy may know 40 people that I've never been exposed to. So it's just a great way to say, I'm going to have a conversation and tap into people that you know indirectly or you've heard of, but you might use Barb as your bridge to that. Does that make sense?
Thanks, everyone. That was just perfect. We didn't even have her queued up. Thank you, Sarah. But I think everyone's contributed. I think that's very true. Sometimes when you break down something that's a conversation, it seems so structured and awkward, but it is just human interaction. And also, there are some more examples in your guidebook, your participation guidebook on page 13, I think through 14, that also kind of help you think of who you want to have as a partner, who you might want to reach out to, and some definitions and things that can also be of help as well. And I guess I did want to give one caveat. I liked the video. It was very condensed and sort of a perfect world in a way. But also it was pre-COVID. If you could see her date book on the table, it said 2018. And I just wanted to say that I think that this, even though that was an in-person meeting and community coalition work and work groups are very personable settings, they have worked very well in this virtual world. So having a phone call or having a one-on-one Zoom meeting can work just as well in this context. And having a Zoom coalition and virtual meeting has worked just as well. Still, the networking's a little challenging, but I think people do still want to get to know each other and meet each other and do some of this very important work. So just to put that out there as well. They did social distance a little bit, but they didn't have, in the one example, but it wasn't quite what we really want people to be doing. So just wanted to throw that out there as well. Okay, so are we back to, do you see my slide as well, the example here? So yes, now at this point, we're going to give it a try. This will be about 15 minutes of time. We're going to split people up into partners. And so everybody's going to be assigned a breakout room, and just give this a try. So just for being time sensitive, the person with the letter, their first name is closer to the beginning of the alphabet will go first. And then the other person, since it is a role play, let's say again, in my home care example, I'm going to be doing the asking. I'm going to be trying to go through the 5 steps in the conversation. And then the other person would be playing a role, like they'll be thinking that they're the director of the discharge unit at a local hospital. So they'll have that lens when I'm asking them. It'll be 5 minutes, just give it a try, see if you can make it all the way through. Then you switch partners. So then the other person would be doing the asking. Let's say you're developing a behavioral health collaborative to increase resources in the community, and you're reaching out to the director of the Department of Mental Health in the state of Michigan. So that person has to play that role. How would they sort of be answering questions in that role play? And then we'll have 5 minutes where you can debrief. Maybe you could talk it through what went well, what didn't go well. Did you get through the 5 steps? And you could write some things down, and then we'll all get back together and have our discussion. But I think we've already had a great discussion. So let's give it a try though.